By my watch, it is now 6 o'clock, and so we will get started with our informational session for parents of the LaFleur and Warren Counties Head Start, Early Head Start. But before we dive into the program, I want to let everyone on the call know that the session is being recorded. And for that reason, we ask that people keep their video and audio muted. And once we get to the question and answer session, you will have an opportunity to interact with us via the chat box. By way of introductions, my name is Carolyn Willis, and I serve as the Vice President of Educational Programs for Delta Health Alliance. Before we again get into the details of our expanded Head Start programs, I'd like to share with you a little about Delta Health Alliance. DHA is a nonprofit organization that has been serving communities in the Mississippi Delta for going on 15 years. Our goal has been to change the face of education and healthcare in the Mississippi Delta by expanding educational opportunities, improving access to health services, and promoting healthier lifestyles. Delta Health Alliance has been a leader in managing innovative education programs in community settings, supporting and operating community-based clinics that serve as medical homes for patients, implementing new technologies such as electronic health records and telehealth diagnosis and treatment centers, and creating robust home visitation programs that address neonatal and early childhood education such as Head Start. In all, Delta Health Alliance has 50 programs and services ranging from Promise Communities in Indianola and Deer Creek, and to the Leland Medical Center, to our Delta Eats Garden program, to the Sunflower County Head Start, Early Head Start Child Care Partnership. DHA is one of the largest employers in the region, offering challenging long-term careers to prospective employees with room for personal and professional growth. Our staff members work in an environment that directly impacts the lives of Delta residents every single day. In the realm of early childhood education, which is why we're here today, our goal is simple: to help kids who need help. We want to prepare children for kindergarten in clean and safe facilities. We've been doing this in Sunflower County, and now we're gearing up to offer these same high-quality services in Warren and LaFleur counties. We are so excited about these new efforts. Delta Health Alliance currently has 11 locations in Sunflower County. Several of our child centers are currently renovated, and all are staffed with trained educational professionals. In our new counties of Warren and LaFleur, we will offer the same level of experience and professionalism by bringing on board more than 200 new staff members in long-term positions. At the same time, we understand we live in a new environment created by the COVID-19 pandemic, and as such, we have to find new and safe and innovative ways to fulfill our mission. An example of that commitment is reflected in our recent completed Head Start Promise School program held this summer. We were able to construct and follow a well-crafted plan that gave children and staff an opportunity to learn and teach in a health-conscious environment. Temperature checks, sanitizing stations, face masks, social distancing, and other CDC recommendations were implemented and strictly followed to ensure the safety of our instructors and students as the school opened and operated to provide these kids with a chance to prepare for kindergarten. As the fall begins a new year, DHA understands that we must continue to be creative and as an organization, meet the needs of the communities we serve in Sunflower, Warren, and LaFleur counties. I would like to close by saying, when it comes to Head Start, Early Head Start child care education, success is truly a team effort. Staff, parents, and students, and the communities play a large and pivotal role in giving our children the tools they need to succeed. This pandemic will end, hopefully soon. And when it does, we want to look back and know that our youngest students not only received the education they deserve, but they have prevailed. I now turn you over to Roshonda Sample, who will talk with you about the startup of the school year. Roshonda?
Good afternoon, Warren and LaFleur counties. My name is Roshonda Sample, and I'm the Director of Compliance for Delta Health Alliance. As the Compliance Director, my primary duty is to ensure the safety of all children, staff, and families that enter our Head Start facilities. Since March 10th, COVID-19 has interrupted our lives, well-being, and daily routines in Mississippi. I want to take a few minutes to share procedures Delta Health Alliance has adopted due to COVID-19. As a team, Delta Health Alliance have reviewed national recommendations and best practices surrounding COVID-19 in an effort to successfully develop a plan of action for our Head Start centers, which we call our DHA's COVID-19 reopening procedures. What DHA is doing to keep your child safe? All DHA funded centers will follow the recommendation of the Centers for Disease Control and the Mississippi State Departments of Health's guidelines for child care centers. These guidelines include an intensified cleaning and disinfection schedule, a modified drop-off and pickup procedures, implementing a screening procedure upon arrival, maintaining an adequate ratio of staff to children to ensure safety, and implementing strong social distancing strategies. Just to share a few of our procedures, maintaining a clean and a safe environment is our priority. Staff must take everyday preventative actions to prevent the spread of respiratory illnesses. DHA have purchased adequate supplies to support healthy hand hygiene behaviors and routine cleaning of objects and surfaces in all our Head Start centers. Additional equipment, including sanitizers and disinfecting machines, have been purchased to intensify the cleaning and sanitation processes in our classrooms and on our buses. All staff members will be thoroughly trained on signs and symptoms of COVID-19. Staff members and older children will wear face coverings within the facilities. In an effort to reduce the spread of COVID-19, each classroom will be assigned a drop-off and pickup time. Parents are responsible for adhering to these assigned times when dropping off or picking up your children. Also on site, we have our COVID-19 screening process. This screening process would include on-site temperature checks of all students and staff, and a COVID health screening prior to entry into all facilities. To reduce exposure to COVID-19 and to minimize the risks to children and staff, no visitors will be allowed inside the centers at this time. During this COVID-19 pandemic crisis, limiting group sizes is crucial to help slow the spread of this virus. Public health officials are recommending that group sizes not exceed 10 individuals. Our staff to child ratio refers to the number of adults that are assigned to specific groups of children. So for our infants, there will be a ratio of 2 adults for every 3 children. For our toddlers and twos, 1 adult for every 4 children. And for our 3s and 4s, there will be 1 adult for every 4 children. So just to talk about our meals just for a second, no family style dining will be permitted in classrooms at this time. Children must be seated on opposite sides of tables when eating. Disposable plates and utensils only will be used, and single serve bottles of milk and water will be served with meals. As I said before, all DHA, Head Start, and Early Head Start staff are required to wear face masks or face coverings while inside the schools. All face coverings should be worn properly by covering both mouth and your nose. If there is a positive case reported by a staff member or a child in the facility, a notice will be sent to all employees and parents. So we know we will have sick staff during this time. So staff members will be temperature checked daily and are not allowed into the center if the temperature is elevated. Staff members are instructed to notify human resource if they are tested for COVID, and testing facilities are now directing tested individuals to self-quarantine until the results are in. So our plan if we have an outbreak. So if facilities need to be closed, all staff and parents will be notified via email. The recommendation time for closure is 2 days, but each case will be evaluated to determine if this is the best option for the center at that time. So you may be asking, how can you help us? We need your help to keep all our children and staff safe. So please monitor your child's health and remain home if you or your child have been exposed to COVID-19 or are currently ill or have a fever. Seek medical attention if you suffer from a fever, cough, or any difficulty breathing. Please don't send your child to the center if he or she has been exposed to someone ill or is or has been sick themselves. That concludes my presentation. Again, my name is Rashonda Sample. I am the Director of Compliance for our Head Start, Early Head Start program and Child Care Partnership. We will share our reopening procedures with all our parents and staff upon our enrollment phase. And now I will turn it over to my colleague, Ms. Marcia Irvin, who will discuss enrollment and recruitment.
Thank you, Rashonda. Good evening. I serve as the Director of Outreach here at Delta Health Alliance, and it gives me great pleasure to welcome each of you to the DHA family. I'm certain many of you on the call are wondering about your child's placement in the program. Some of you may be wondering if your child still have a slot in the program, or some of you may have general questions about how to complete an application to enroll your child into the Delta Health Alliance Head Start, Early Head Start program. So I'm going to spend a little time discussing the various phases of enrollment to provide you with information, and I hope to clear up some of these questions so you will have a better understanding on the next steps you need to take to ensure your child is enrolled. The Head Start program is for children ages 3 up to the age of 5. Your child must be 3 by September 1st to enroll in the Head Start program. If your child was already enrolled in MAP's program last year, your child will be grandfathered into the DHA Head Start program. The Early Head Start program is for children 8 weeks up to the age of 3. If your child was enrolled in MAP's Early Head Start program and they will not be 3 by September 1st, your child still qualify for the Early Head Start program, and your child will be grandfathered into DHA's Early Head Start program. However, if your child was enrolled in MAP's Early Head Start program last year, and your child has turned 3 or will be 3 by September 1st, your child no longer qualify for the Early Head Start program, and you must complete a new application for the Head Start program. In order to be grandfathered into either Delta Health Alliance Head Start or Early Head Start program, we must first obtain your child's file from MAP. Once we receive your child's file, you would then need to complete enrollment documents for the 2020-21 program year. If you have already signed a consent form with MAP, giving them permission to transfer your file to DHA, we will follow up with MAP to retrieve your child's file, and a member of the family service team will contact you. If you completed a new application or enrollment documents with the previous grantee, those documents are not valid for this program. and a new application or enrollment documents with DHA must be completed. Therefore, if your child was not enrolled with the previous grantee last school year, or your child no longer qualifies for the Early Head Start program because your child will be 3 by September 1st, you must complete a new application. To complete a new application, you will need the following: proof of birth for your child, and this can be your child's birth certificate or a certificate of birth. In some cases, we accept the immunization record as proof of birth. However, you must work towards obtaining a certificate of birth or a birth certificate to complete your child's file. You will also need to provide proof of income, such as a W-2, 1040 tax form, recent check stubs, Social Security award letter, or any documentation you have that will verify your household income. If you have zero income, are homeless, or caring for a foster child, a member of the family service team will work with you to obtain the documentation you will need. More information regarding acceptable income and other required documentation can be found on our Facebook page. Please like and follow us on Facebook. For families that need to sign consent forms to have their child files released, or families that need to complete new applications or enrollment documents, the family service team will be on location on the following days: Warren County at the King and Cedar Center, Wednesday, September 9th and Thursday, September 10th from 10 until 3 p.m. LaFleur County at the Gilliam Head Start Building, Wednesday, September 16th and Thursday, September 17th from 10 until 3 p.m. To adhere to social distancing policies and minimize crowds, we will be providing appointments only. If you have not done so already, please contact us to provide your current contact information. We can be reached by email at applications, that's APPLICATIONS at deltahealthalliance.org. You can leave a voicemail message at 662-686-3949 or send us a message on Facebook with your contact information. Contact information must be your name, county where you live, and current contact numbers. All other information will be collected when you are called to be scheduled for your appointment. Only parents and legal guardians are allowed to sign consent forms, complete applications, and enrollment documents. If you are unable to attend on the following dates, other dates will be scheduled in the future. They will be posted to our Facebook page, and this is why it is very important that you like and follow us on Facebook. If you know of any families that were unable to be on this call this evening, or families that could benefit from our program, please share this information with them. Our goal is to reach every family that was enrolled in the previous program and every family that need our services. Serving children and families is something that we are very proud of and work very hard to do. And we need your help with getting this information out into the community. We are also excited to announce that we will be providing services to the expected mothers in both Warren and LaFleur counties. Our prenatal program guarantees your child a slot in the Early Head Start program once the child has received their 2-month immunization, and this generally happens slightly before the child turns 8 weeks of age. If you know expected moms in your area, please give them our information and let them know we are here to serve them as well. The love of learning begins in Head Start. Head Start alumni have gone on to become business owners and artists, musicians and doctors, teachers, and even members of Congress. For instance, Danny Glover is a proud Head Start parent. Chris Rock attended Head Start in Brooklyn, New York. And Shaquille O'Neal is a former Head Start alumni, just to name a few. There are many prominent individuals in this country that would tell you it all began for them in a Head Start program. And when your child grow up, we want them to be able to say the same thing. We are more than just an early learning program. We provide health and nutrition education, parenting skills training, and support services to meet the needs of the entire family. The services you obtain here are not just for while your child is enrolled in this program. We work to develop the overall parent and family well-being, while developing parents to become lifelong learners, advocates, and leaders for their families. The services you receive in this Head Start program will take you and your family through Head Start and beyond, as well as ensure that your child is successful in school and in life. To obtain and maintain this success in school, a child must be healthy and well. Health is a number one component for school readiness. A child must be healthy in order to learn, and we focus heavily on every child's health and well-being. Our program follows the Mississippi EPSDT schedule for well child exams and the Mississippi Dental Periodicity schedule for dental exams. If you do not have a primary doctor or dentist for your child, our staff will work with you to help you obtain one. If your child does not have a current well child or dental exam, please schedule and have them completed before school begins. We will provide you with more information regarding well child and dental exams during the application and enrollment process. As I close, I want all of you to know that we understand this transition is new and can be overwhelming, but we are here to help guide you through this process. Now I'm going to turn things over to Marilyn Grice, who will speak to you about our transportation services. Thank you, and once again, my name is Marcia.
Thank you, Marcia. My name is Marilyn Grice. I am the Transportation Manager for Delta Health Alliance, and I will be discussing transportation today. First of all, transportation services are not required as part of Head Start, of the Head Start program. However, Delta Health Alliance will provide these services for 3- and 4-year-old Head Start children who, number one, need transportation, number two, have no other means of transportation, or the route they would travel to come to school is an unsafe route. Parents with transportation and capable of transporting their children are expected to transport them. Let me repeat that one more time. Parents who have their own transportation and are capable of transporting their children are expected to transport them. In addition, when a transportation need is identified for a child with a diagnosed disability, this is referred to our Director of Disability, Becky Dean, or other designated staff persons who will look for all possible resources. Head Start programs must follow the regulation that is most stringent or what will work best for the children and the program. This program is not utilizing a door-to-door route, but we will set up cluster stops or pickup points instead, which will enable us to only have the children on that bus for 1 hour or less. DHA's goal is to provide safe and efficient transportation appropriate to the needs of young children. We adhere to all required Head Start performance standards that pertain to transportation and take the utmost care in making sure that the children are properly transported to and from school. For those children who meet the criteria as mentioned, parents can request transportation, and this can be done when you enroll your children. The family service coordinator will give you the transportation application during that time. The FSC will then submit that application to the transportation manager, which is me, Marilyn Grice. Then I will review that application to determine if your child or your children are in fact in need of transportation. If the child or the children are approved, then the application will be sent back to the family service coordinator, and she will inform you, the parent, that your child or your children have been approved for transportation, and given at that time, you'll be given the location of where that cluster stop or that pickup point is set up, and the location as well as the time of pickup. At this time, well, that ends my little short version of transportation. So I will now turn you over to Monica May, and she will talk to you about early education and family engagement. Monica?
Good evening, everyone. Thank you for joining us. My name is Monica May, and I'm the Director of Early Education at the Delta Health Alliance. And I have the privilege of sharing with you some exciting information in regards to the types of learning activities that we can provide for you and your child while they're in our setting. So first, let me say that the Delta Health Alliance is committed to providing and supporting a strong foundation of learning for children birth through 4 years old during the most critical times for their academic, social, emotional, physical, and motor development, which will help sustain their school readiness skills over time. We are doing everything we can to prepare to help you and your child live, grow, and learn along the way. Your child's learning, health, and safety are our 3 top priorities. One of the areas that we are focusing on our efforts is ensuring that we provide your child with a multitude of opportunities for ongoing educational learning experiences, both inside the classroom as well as virtually at this time. So you may say, well, how will that work? What's it going to look like? Hopefully, as I move through probably 4 key components to the education part, you will gain some knowledge there. So let me first talk about the early learning environment. The Delta Health Alliance has established a goal for opening to serve children and families and education staff in both Warren and LaFleur County. That goal is set for mid-October, 1st of November. Of course, that is dependent on many factors that based on maintenance or repairs that we need to make. So we will keep you posted, but that is our goal. The Delta Health Alliance will serve early Head Start children year-round. So that is the goal of our early Head Start program. And our Head Start children will be provided services at this time from August until May. So the Delta Health Alliance also currently provides a promised school during the summer for 6 weeks for children that are entering kindergarten from our programs to enhance their school readiness skills. The Delta Health Alliance is dedicated to implementing a research-based, high-quality, developmentally appropriate practices in all of our learning environments, whether in person or virtually online. The implementation strategies are based on national and state early education standards and guidelines to support and implement best practices for your child. So another area of education is curriculum. The Delta Health Alliance is implementing 2 research-based curriculums throughout our programs. The curriculum outcomes are aligned with the developmentally appropriate learning goals and objectives to meet the needs of all children in our program with ongoing monitoring and assessment and observational checklists. The 2 curriculums that I'm speaking of, one is creative curriculum, which is being utilized in our infants through 3-year-old classrooms, and the Opening the World to Learning, which you also may hear referred to as OWL, is being utilized in all of our 4-year-old classrooms. So we can move on to the AB schedule. So in this unprecedented time, the Delta Health Alliance has determined an AB schedule to serve our children, families, and our community most effectively. An AB schedule will provide your child with consistent, ongoing, high-quality teacher-child interactions on a weekly basis, depending on which week designation you receive of an A schedule or a B schedule. An AB schedule will enable your child to come to in-person classroom experiences with practicing social distancing in all areas every other week, 5 days a week, up to 8 hours a day. And so our hours of operation that we're currently working under are a 7:30 to 3:30 because we have the virtual component as our off week. So as we talk about virtual learning, on the week that your child is not on site in the classroom, virtual learning opportunities are based on the research-based curriculums that I spoke of earlier and will be provided to your child and family through our Delta Health Alliance Learning Hub, our website. Those are organized by themes when you go on there to look and check out things that are going on with the Delta Health Alliance. But they're organized by themes and through live teacher-led Zoom in the room opportunities. The virtual learning links and videos are in connection with hands-on learning activities that will be sent home each Friday for on-site learning and or as instructed to help you engage with your child in meaningful virtual learning to continue to promote those school readiness skills needed for kindergarten readiness. So by providing multiple avenues of learning opportunities, the Delta Health Alliance has come together to create the most effective learning environment to meet the needs of your child and help them thrive in Mississippi during these most unprecedented times. So I thank you for your time. And now I would like to turn it back over to one of our Head Start alumni and our Vice President, Carolyn Willis.
Thank you so much, Monica and team. We really appreciate the time and the effort that our staff has put into presenting in their different content areas. We hope this Zoom meeting was helpful for you. We certainly would have preferred to have this meeting with you in person, and as we get to know you and the communities in LaFleur and Warren County. But given COVID, we have tried to do the best that we can given the situation. Prior to the meeting, we did ask for questions to be submitted prior, and we do have some questions. And so we'll now get into the question and answer session of the presentation. And as we go through some of the questions, we will also open the chat box so that you have an opportunity there to submit questions. We have about 30 more minutes into this presentation, and so we'll try to go through as many of the questions as we can. However, if we do not have a chance to get through all of the questions, rest assured this presentation will be posted on our website and other social media, and you will also be given information at the end of the presentation as to how you're able to get to the Delta Health Alliance website, as well as submit information via email. So the first question is, I think Marcia can take this one. I already filled out an application form. Do I have to fill out another one? Marcia?
Hi, the answer is yes. The application that you filled out was with the previous grantee. You must fill out an application and enrollment documents with Delta Health Alliance.
So Marcia, again, you mentioned earlier about the consent form. Will you tell us more about the consent form and how anyone on the call may be able to get a consent form?
All families, in order for Delta Health Alliance to obtain the children files from the previous program, a consent form must be signed by the parents, releasing that agency and that file to us. When we're on location in Warren County and in LaFleur County, we will have consent forms. If families have not had the opportunity to sign the consent form with MAP, we will have consent forms, and consent forms can be signed in September. We will submit the consent forms to MAP, and we will request the children files.
Thank you, Marcia. Marilyn, this question is for you. I believe you've already answered it, but will you have transportation?
Okay, thank you, Carolyn. And let me apologize for my video. I'm having difficulty in the office here. But anyway, yes, we will have transportation, but transportation will be provided to those children, as I said previously, who are in need of being transported and have no other means of transportation. And we all know that due to COVID-19, with our routes here in Sunflower County, we're closely following the CDC and the Mississippi Department of Health guidelines of wearing the proper personal protective equipment, as well as carrying out the health checks and the temperature readings before boarding the bus. We are making sure that we're socially distant on that school bus. And then also extra cleaning is being done between trips and between routes. Also, I need to really stress how important it is that we're recommending to those parents who can transport their children during this pandemic to please do so. That is the safest thing right now for your babies. Thank you, Carol.
Thank you, Marilyn. So, Monica, we have a question. When will school start back for children?
Okay, DHA has established, as I mentioned earlier, a goal of opening mid-fall, which means mid-October, 1st of November. Of course, those opening date ranges depends on the status of the buildings, the repairs that need to be made, the necessary maintenance that's needed to bring the sites to the highest level of quality to serve you guys as children and families and education staff in those communities.
Thank you. So we have a question in the chat box, and I think, Marcia, this one is for you. If we already did the consent form, do we have to do an application again?
If you have signed a consent form and your child still qualify for Head Start, we will obtain their file from MAP, and your child will be grandfathered into the program. You will not have to do the eligibility part. So no, you will not have to do an application. However, if your child was in the early Head Start program with MAP and your child will turn 3 by September 1st, your child no longer qualify for early Head Start, and you will have to complete a new application for the Head Start program. However, if your child still qualifies for early Head Start, you will not have to complete a new application.
So sticking with applications, Marcia, another question. When will we be able to put applications in for children? Will it be a virtual application or an in-person application?
All of our applications are in person. The application phase give us an opportunity to get to know our families. And it also give our families the opportunity to get to know us. So our applications are in person. We can guide you all better through the application phase versus completing a virtual application. However, due to COVID, some components will be virtual. At Cedar, King, and Gilliam next month, that will be in person. Some phases as we move forward, we will be able to do so much virtually, but the remainder of the application process will have to be in person.
Thank you, Marcia. So this is a question. I've not had this one. Will uniforms be required? Who wants to take that one? Monica?
Yes, we do not have a requirement for uniforms. We engage in lots of hands-on learning in our classrooms, and we want children to come dressed, ready to engage and learn and play in their day. So uniforms are not required, but comfortable, wearable clothes are required.
Okay. So 2 questions regarding applications, Marcia. What if you were a new applicant? Would the consent form be for those also or returning applicants?
The consent form is for returning applicants only because we need the file, your previous file from MAP, in order to verify that you were previously in the program, and so you are able to be grandfathered into the Delta Health Alliance program.
Okay.
New applicants are not required to sign a consent form.
And so will you repeat the information about the dates next month to do the application by location?
Yes. Warren County at the King and Cedar Center, Wednesday, September 9th and Thursday, September 10th from 10 to 3 p.m. LaFleur County at the Gilliam Head Start Building, Wednesday, September 16th and Thursday, September 17th from 10 and to 3 p.m. And I also want to remind everyone that it is appointment only. So you do need to reach out to us and give us your contact information, and someone will contact you and schedule you for an appointment.
Thank you, Marcia. Monica, this one is for you. Will you have a virtual option if I'm scared to send my child?
Of course, that's a great question. The Delta Health Alliance is currently planning to launch an option of virtual learning as needed beginning in September 2020 for our children and families that do not feel safe on a case-by-case basis. As I shared previously, we are currently engaged in an A-B schedule and that promotes both in-person and virtual in an A-B week when learning from home. The expectations for virtual learning consist of active, ongoing participation for up to 30 minutes, 3 days a week, with options such as, but not limited to, the Zoom in the Room that I talked about, where you are sent an invite. We post them on our Facebook, so you guys can go to our Facebook page and see really what we're doing and engage in the ones that we're offering now. And our Learning Hub video segments that we have that follow themes, different things with reading books, doing developmentally appropriate activities with your children, encouraging family engagement along the way, are different virtual platforms that we are currently using. Delta Health Alliance will provide children and families with developmentally appropriate take-home learning activities to engage in while learning at home. I hope that answers your question.
Thank you, Monica. Ricky, will you do us a favor and put up our contact information? We have a participant who wants to know what's a good number I can give my information for an appointment. So there you have it. The phone number is 662-686-3949. Again, 662-686-3949. You can also reach us at applications@deltahealthalliance.org or www.deltahealthalliance.org is where you can find additional information. And so, Marcia, remind us again the kind of information that you'd like to be left on the voicemail and also in the applications portion, please.
Your name, the county where you live, and a current contact number where we can reach you.
So Marcia, while we have you, will breakfast, lunch, and snacks be provided?
Yes. Breakfast, lunch, and a snack will be provided to each child daily.
Okay. So Monica, I think this is one for you. If we have to close for COVID, will we be provided learning materials?
So that is a question that is similar to the last a little bit, but the Delta Health Alliance is actively planning learning opportunities for children and families to engage in when not on site or in person for in-person learning. The Delta Health Alliance plans to continue intentional learning based on the research-based creative curriculum and opening the world of learning curriculum that is being implemented in our classrooms through virtual platform options, as previously stated. The Delta Health Alliance will provide children and families with those developmentally appropriate take-home learning activities to engage in learning at home.
Thank you. So we have a question. Is it okay to inbox the page on Facebook for an appointment, Marcia?
Could you repeat that question, Carolyn?
Yeah, is it okay to inbox the page on Facebook for an appointment?
Yes, you can. That's also a great way to reach us, to send a message via Facebook with your name, contact number, and the county that you live in. All other information will be collected at the time of the appointment scheduling.
Marcia, how old does my child have to be?
For early Head Start, a child must be between 8 weeks up to the age of 3. For Head Start, a child must be between the ages of from 3 up to the age of 5. For prenatal, expected moms, the mother must be in her first trimester.
Right, thanks, Marcia. Monica, this is for you. Do y'all potty train?
Yes, ma'am.
Okay, great. So,
Of course, we potty train. Let me make sure I'm on. Of course, yes, the Delta Health Alliance will work in partnership with children and families to meet these developmental milestones at both home and at school. The Delta Health Alliance will initiate a parent-teacher conference before any next steps take place to discuss the partnership and responsibilities for a successful potty training experience for all engaged. The Delta Health Alliance does provide diapers and pull-ups at school and training resources for families to utilize and grow understanding of this process. Of course, families that choose to use training pants will be asked as part of their partnership agreement to provide those throughout the process.
thank you, Monica. Marcia, how will you let me know if my child gets to attend?
Upon completion of every application, every family will receive a letter from the program notifying you of the status of your child as far as the wait list and acceptance.
So, any other questions in the chat box? So, there being no other questions in the chat box, we want to make sure that everyone, especially those who may have tuned in a little bit late, have an opportunity to hear kind of the gist of the conversation. Oh, we do have a question in the chat box before we go in that direction. The dates again for LaFleur, please confirm, Marcia, September 16th, and what are the hours?
September 16th for LaFleur County, Wednesday and Thursday. So September 16th and Thursday, September 17th from 10 until 3 p.m. And also I ask that everybody please follow us on Facebook because this information will be posted on Facebook periodically as reminders. And as we add more application and enrollment dates, that information will be shared on Facebook. So please follow us on Facebook.
All righty, Roshonda, give us please kind of an overview of what you have stated to everyone regarding reopening during COVID.
Overview, Carol.
Yeah, just a brief.
Okay. So just to hit on some of the high points, we are trying our best here at Delta Health Alliance to follow not only state guidelines, but also national best practices used at the CDC, American Pediatrics Association, EPA, and some more other organization that governs our project, especially Office of Head Start, CFP, USDA, and others. Just 5 things we know we will do during opening would be implementing a strong social distancing policy. We would have intensified cleaning and sanitation practices. We will modify our drop-off and pickup procedures and implement screening on site for all staff and students. And then we will maintain appropriate ratios specified by the state of less than 10 pupils in a room together. So those are just some little snippets of what we plan on doing.
Carla has a question in the chat box. What documents are needed during registration/application process? Good question.
Hi. Okay, the documents you're going to need is proof of birth for your child. And this can be your child's birth certificate or a certificate of birth. As I said earlier, in some cases, we do accept the immunization record, but in order to complete your child's file, we're going to need that certificate of birth or birth certificate. And you can obtain a certificate of birth from the hospital where your child was born. We will also need proof of your household income, your last 4 recent check stubs, your W-2 for the 2019 year, 1040 tax forms, if you receive Social Security, a Social Security award letter, child support printout, or any documentation you have that will verify your household income. Now, if you have zero income, if you're homeless, caring for a foster child, we will work with you to help you obtain the documentation that you will need. Also, if your child receives Medicaid, if you have the Medicaid number for your child or a card, so that we can obtain a copy of your child's Medicaid card. And any other information, any other documentation needed, we will walk you through that process because each person is different and documents required will be different based on the family and the family circumstances. So we walk each family step by step through what they will need to bring with them to the application process. But the 2 most important documents needed, I'm sorry, 3, proof of birth, proof of income, and your ID, because you must be the parent or legal guardian in order to complete an application, enrollment document, or sign a consent form.
Okay. Marcia, what about the Form 121?
The child's immunization record, yes,
Yes.
that's one of the documents that we're going to walk families through when we schedule their appointment. Every family, every child needs a 121 form at application. If your child's 121, and I understand due to COVID and appointments are backlogged, if your child's 121 is not up to date, is not current, still bring that 121. Your child cannot be placed in a center with an expired 121, but you can complete an application with an expired 121. Also, more information that will be shared on Facebook as well as during the enrollment phase. Parents can now go online and print out their child's 121 form as long as it is current and the child is not behind on immunizations.
Marcia, anything else you want to impart before we move on?
The last thing I would like to share with the parents that's on the call, our program works if you help us work it. And if you know of any families that need our services, that was in our services, that may not have gotten the message to be on this call tonight, inform them. Word of mouth is sometimes often better than social media. So if you just share this message in the community, give them the information as to where to go to locate us on Facebook, on social media, on the web, our telephone number, and contact us so that we can complete applications or consent forms if needed, an enrollment document. So all of these children, when our doors open, will be starting together.
Thank you, Marcia. Marilyn, any last words? You're on mute, Marilyn.
Sorry. Just if you have questions, just for transportation, the family service coordinator, once you start filling out your application for enrollment, she can answer whatever questions you need. You can reach out to us by means of our Facebook page, and we will answer whatever questions you parents might have. Thank you.
All right. And Monica, wrapping up.
I just want to thank you guys again for coming on and showing your investment in your children's future. We hope that you're excited to see us come into your communities, and we can't wait to see you come through our doors so that we can help and partner with you to provide your children with a high quality foundation of learning that's going to help them grow and learn and be productive and contributing members of society. So thank you very much, and we look forward to meeting you.
So again, thank you for joining us this evening. We know that you had many, many other things that you could have been doing. It is our pleasure to host this meeting, and we look forward to meeting you in person. Thank you for allowing us into your home. And so again, we are, let's see, one last question in the chat box. So school will no longer get out at 2, but at 3:30, and they will go 1 week and skip a week. So explain that a little, Monica.
Sure. That is what DHA, we did some surveys with families in Sunflower County, and that is what we're currently serving. And so we're going to duplicate that at this time to the best of our ability in both Warren and LaFleur counties. And the way that it looks with that AB schedule is, yes, we wanted the most time that we could have with your children in a safe, compliant learning environment so that we could help fill these educational gaps that are being identified since children have been out of school since March. We know that there's so much learning that has been missed because it hasn't been every day. So when the department, when DHA came to the agreement and the decision to serve your children, your family, and our community, we came to that decision of, if we can have these children at this time, that doesn't mean it's going to be forever, but this is our temporary solution to the situation that we're in, is to serve these children for up to 8 hours a day, 5 days a week. So we get 10 whole days with your child, up to maybe 11 or even 12, the way that the weeks split out. But we would get up to 10 full days with your children a month, compared to what some school districts are doing, where they're only getting 2 days a week. So that means that they're getting 8 days a month, but they might only be getting a half a day. So we at DHA want to help you and your family be empowered to be successful as a unit. And so we also felt that this AB schedule would assist you as families to be able to talk to your supervisors and say, you know what, I am in my children are in a program, and I have the ability to work this whole week, but next week I do have to be virtual. Or maybe you don't have to inconvenience a family member every week or every day, but just, you know, a couple weeks out of a month. So this is our solution at this time. And we did also extend the hours. So we are talking to y'all and our communities to say, we're getting you for more days and longer times, and that's going to help bridge those education gaps that they're identifying for our children. And so we want to have them for as many days and as long as we can to help them learn, and but to also continue that learning virtually when they go home. So I hope that answers your question.
Well, it sounds like it. So it sounds like a great idea. And it's temporary, just until COVID is no more. So then we hope to go back to a normal schedule. Again, thank you so much for participating in our call today. The contact information is on the screen. Like us on Facebook, also Instagram. Thank you so much again. Enjoy the rest of your evening.